wheelchairs.
I'm looking through your stuff.
That was so weird. They're just like using out both doors to go through wheelchairs.
Which doors?
Both of the doors.
No, they're like trying to learn. Oh, you got it. Okay.
How to do the wheelchairs through the the buttons.
And so I'm just standing there awkwardly, like, can I go? Yeah.
You just have said, excuse me, I'm late for class. Go.
Yeah.
Okay. Yeah, they usually go out there and play outside, so we're not doing that, but obviously they have to figure out how to use it. Okay, midterm, patient care. We'll be covering, patient lifting and moving. We'll also be covering a little bit. I wanted to continue, I know that we did this last semester, but I want to make sure that we covered a little bit more about nutrition, because that's important for patients. And I also we'll do some emergencies. Okay, so let's start with lifting and moving. You've got a quadriplegic patient on the bed, on a stretcher, gurney, call it what you will. You need to move him or her onto the treatment bed. How many people minimum do you need?
Quadriplegic.
Quadriplegic.
Probably at minimum 4.
Minimum 4. In practice, as many as you can get. So a minimum 4. Describe how you would, when you're lifting something or someone, which muscles do you use?
Your legs.
Your legs. Never your back. Never your back. Okay. So if you have a patient who can only move one side of his body, they've had a stroke or they've lost the use of one side of the body, you're helping them move. Which side of the patient do you want to be on?
The weak.
You want to be on the weak side, you want to be on the strong side. Why?
Because they can use their strong side. You want to be like
To
their
help.
support.
You support the weak side, yeah. Okay. So you have a patient in a wheelchair that is weight bearing. Have they stolen our wheelchair, talking of which? Is our wheelchair still back
There's a
there?
wheelchair back there.
There
I was
is
gonna
one?
blame it on them.
Okay,
outside.
that's fine, because sometimes they come in and steal it, or borrow it. That's why I've got radiation therapy written on. Anyway, so you have a patient in a wheelchair who can weight bear. So there are several types of lifts that you can use. Which lift might you use? Which type of lift might you use?
Approaching from the front and under their arms, right? And then
So what's that called? That's called a swivel. Swivel lift. Okay. What else? Is there anything else? Usually it's a swivel lift. If they're weight bearing, you don't have to lift them. You just sort of stand by and make sure everything is good. Or you can, usually it's a stand, twist, sit, called a swivel. Okay. This one we've already asked. Take that out. Okay. What's a slide board?
You use it to help you move a patient when they're laying on their back, right?
What is it?
That's like,
What is it like though? What does it look like?
It's like hard, has holes in it.
Got it?
It's like hard, and
Yeah.
it has like holes for handles.
Okay. Is it this size or this size or what does it actually look like?
medium.
Hmm?
Like,
Have you ever seen one?
I think in a picture.
Okay.
The one-
So-
The one we had at the prison, we had to have one in every dorm. It was
Right.
like roughly 6.5, 7 feet long, and
Mhm.
I'd say 2 feet wide, but they had
Yeah.
handles on each side.
That's right. Yeah, that's right. It's, if you've ever seen the paramedics running around with a backboard, does everybody know what I mean by a backboard? That is similar to a slide board. The only difference is that it's usually thinner and it's not, it's anti-static, because you don't want to slide a patient over and give them a static charge.
So they're used to move a patient from a,
Stretcher to a bed, or the bed to a stretcher, or
but you tilt them up and.
No,
and put it under them,
roll them.
you roll them,
and then roll it back.
you do a log roll, you put the backboard or the slide board underneath them, you roll them back, and then you roll them the other way, make sure the board is all the way underneath them, and then you can either lift them or you can slide them. Sometimes it's easier to put the board half under and then slide them over the board, rather than put the board all the way underneath like a backboard would be. So this brings me to my next question. A sliding board, can a sliding board be left in place under the patient's body when training? Yes or no?
No.
Why?
The material that it's made disrupts the change treatment.
Okay. Yeah, most of the sliding, in an emergency, you probably could, but it should not be used. It should not be left underneath the patient. First of all, it's damn uncomfortable. And two, you're right, it will absorb some of the radiation. So the rules for lifting a patient require which of the following, and I'll give you them. Feet wide apart with one foot placed in front of the other. Weight should be kept at the waist. Keep back straight, or all of the above.
All of
Oh.
Okay. So let's go to some nutrition questions. Your patient is having trouble eating. So which of the following would you suggest? Only eat 3 meals a day so you're hungry at mealtimes. Avoid foods that are soft. Use nutritional shakes to provide extra calories and protein, or all of the above.
Nutrition.
Nutritional shakes. Good. That was in unicorn. That's nice. That was in unison. Okay. What is the most common side effect of cancer treatment? So I'm giving you some ideas. loss of appetite, fatigue, loss of hair, skin, erythema. Hmm?
Fatigue.
Fatigue. That is the most common, and it doesn't matter what area you're treating, you could be treating a big toe. But for some reason, almost all cancer patients are fatigued. Patients with nausea should avoid which of the following foods? And again, I'll read you some. Spicy, greasy, hot, and very sweet foods. Spicy, greasy, cold, and sour. Ice chips, crackers, and very sweet foods. Spicy, greasy, dry, and sour.
Last one?
Spicy, greasy.
The last one.
Spicy, greasy, dry. Sour.
They should actually avoid all the spicy or greasy foods, but
But it tastes so good.
yeah,
Dry and what?
Sour.
dry and sour.
Sounds amazing. It's two different ones.
Yeah.
Oh, the sour no. Spicy and greasy.
Yeah. Okay. Oral mucositis can result in what?
Oral mucositis.
Oral mucositis can, I'll give you some. Decreased dietary intake, dehydration, malnutrition, or all of the above.
All of the above.
Yep, all of the above.
This exam seems maybe a little.
Okay.
Common sense, but
Taste alterations can include what is called mouth blindness, meat aversion, increased ability to taste salt and sugar, or all of the above.
All of the above.
Yes.
Is it taste?
Alteration.
Alteration.
Taste alterations.
Can you repeat this again? The last one out.
The last one?
Yeah, what was the last one?
Oh, you mean, okay, taste alterations can include mouth blindness, meat aversion, increased ability to taste salt and sugar, or all of the above.
So increased ability to taste salt and sugar? Huh.
Yeah. Although sometimes it's one or the other. So you may not like salty foods, but when you're on treatment for head and neck, you can crave salty foods, or you can not taste salty foods.
Cheese.
It can change. You can change your taste totally. Okay. Side effects common with both chemo and radiation. So we have 4 of them, and they can be a combination of the 4. Dehydration and electrolyte imbalance, food aversions, weight gain, or poor intake of food and beverages.
This was side effects of what again? I'm sorry.
Both chemo and radiation.
Of both.
Both, yeah. So we have dehydration and electrolyte imbalance, food aversions, weight gain, poor intake of food and beverages. So you can have a combination of all of the above. So is there one which you would not expect?
Weight gain.
Weight gain.
What about the others?
Let's see. Possible.
Yeah, so it's basically 1, 2, and 4, right? So you would expect them to have dehydration and or electrolyte imbalance. You would expect them to have food aversions. You know, you used to love hamburger, now you can't stand the stuff. And poor intake of food and vegetables, you have to force them to eat food and vegetables. Or food, beverages. Okay, so this is a true and false one. Patients should avoid physical activity since it can make them too tired to eat.
False.
They should get some. Another true and false one. Using a straw can make swallowing easier in patients suffering from oral mucositis.
True.
True?
False. Oh.
Using a straw
Ruby?
can help. You said?
Pardon?
Yeah.
Can make swallowing easier
Yeah, I
in
guess.
patients suffering from oral mucositis.
Well, I don't know because you have to like suck
How does
harder.
it
I still
affect the
think that,
mucus?
yeah, I feel like it wouldn't.
Well, if you're wanting to get them to swallow something and you can avoid the mucus because the mucositis is making their mouth sore,
Less chewing, yeah,
right?
less.
So would a straw help that?
Yeah.
I would think, except for you've got a suck on it, so it seems like that would hurt your mouth too.
In that case, it might depend on what you're trying to drink. I mean, water is probably easier. It seems like a more direct route.
Some patients in practice find it more difficult swallowing water than they do actually eating something else. Yes.
No,
So does the straw help?
Pardon?
So the straw does
The
help?
straw does help occasionally. So it will help, but not, not a lot, but it will help. Okay, okay, so go into emergencies now. Which of the following type of shock may occur during CT simulation? Hypovolemic, septic, neurogenic, cardiogenic, anaphylactic.
Wow. What's the first one?
Hypovolemic. So a hypovolemic, septic, neurogenic, cardiogenic, anaphylactic.
Pretty much I'm gonna guess cardio.
So let's go through them all, shall we?
Yes.
So what does hypovolemic shock mean?
Not enough fluids.
Yeah. So are we doing anything in CT to cause something like that? So that's scrubbed, right? What is septic shock?
Infection in blood.
Infection, so we're not likely to do anything like that, right? Okay. Neurogenic, what is neurogenic shock?
Brain.
The brain. Are we likely to do anything to harm the brain? No. Okay. Cardiogenic,
Art.
so are we likely to do anything for that?
No.
Not really. Unless, of course, the patient has a history of cardiac problems, then you may, but.
I'm thinking maybe
So we're left with
Anaphylactic.
anaphylactic.
Oh.
So what would we likely do in CT that might cause an anaphylactic shock? Contrast, thank you. We're giving, some of the patients are given contrast. And that, you give something by IV, the chances are that you might occasionally have somebody who's allergic. And hopefully you'll never see an anaphylactic shock or anaphylaxis in CT, but it is possible. Okay. Which of the following is not a symptom of cerebrovascular accident? slurred speech, one-sided muscle weakness, low blood sugar, temporary loss of consciousness.
No blood.
Low blood sugar. So what is a cerebrovascular accident or a CVA?
A stroke.
It's a stroke, yeah. So a stroke can have slurred speech, can have one-sided muscle weakness, and it can make them have a temporary loss of consciousness. So, yeah. Epistaxis is another name for what?
Is it a nosebleed?
It's a nosebleed, yeah. Which of the following, hang on a minute. Okay. Which of the following treatments is appropriate when a patient is experiencing syncope? Heimlich, assist the patient to lie down and elevate the feet, use an AED, call a code and begin CPR.
Lie down.
Assist them to lie down.
Lie down and elevate the feet. So what is syncope? Pardon? They're fainted. The patient's fainted. So you lie them down, the feet come up in the air.
Girl fainted in the microcosm.
Patient who reports that he feels as if the room is spinning is experiencing what?
Vertigo.
Sorry, guys.
I heard vertigo before the crash happened here. No, not vertigo. So the patient's been lying down. He or she sits up, you help them sit up, and they say, hang on, the room's spinning.
Can we get a choice?
Pardon?
Can we get choices? I think I'll remember it if I hear it. Yeah, I'll know I'll hear it.
Something, I thought.
It's something to do with
Hypo
changing
what?
positions.
Orthostatic hypotension.
Oh,
There you
Yeah.
go.
Oh,
Postural, actually it's postural hypertension.
Oh.
Sterile.
Oh,
Same
yeah.
thing, it's like same thing, yeah, it's the same thing. Postural hypertension. What type of tumor is most likely to cause a spinal cord compression? So we have primary breast, metastatic bone, primary prostate, primary colon.
Metastatic bone.
So how does that manage to cause a spinal cord compression?
Tumor of the bone growing into the interior cavity where the spinal cord is.
Right, so it pushes or invades. Okay. What is the function of dexamethasone
Wait, I have some at my house.
in the treatment of spinal cord compression?
How do you spell
Dexamethasone,
Look it up.
commonly known as Decadron. Dexamethasone is DEXAMETHASONE.
Got it right.
Dexamethasone. What is it used for? We went over this last time. What is, first of all, what is dexamethasone or Decadron?
Is it a steroid?
It's a steroid, thank you.
So you're-
So what would it be used for?
Information?
Inflammation, the relief of such, okay? It's a relief of swelling or inflammation. Remember, the spinal cord compression is part of the CNS system, central nervous system. Anytime you have a tumor in the central nervous system, think about it, the spine, where would you get the tumor, the spine or the brain? In either one, there is not an awful of room for swelling. So you have to get the swelling down immediately, or fast anyway. So you use dexamethasone, or its other name is Decadron. And you give it to the patient and it reduces the swelling and therefore reduces the side effects of that swelling, which are headaches, nausea, vomiting, just being very uncomfortable. What dose regime is usually given in the US for the above problem, which is the spinal cord compression? I'll give you them. 2005, 3010, 4015, or no radiation is given.
What were the options again?
2005, 3010, 4015, or none at all. What regime is given in the US?
Or the spinal cord?
Spinal cord compression.
415, or 4015?
Not at all.
It's 3010, usually. In the US. In the UK, it would be 2005. Okay. Which tumor is the main cause of superior vena cava obstruction? Would it be lymphoma, lung cancer, other malignancy, or benign disease? I hear lung. Which of the following is not a symptom of SVC obstruction? Swelling of the face and neck, distended veins, shortness of breath, or diarrhea? Diarrhea. What can I say? Yeah, diarrhea is right. Okay, let's change tack here. Okay, fire extinguishers must be checked at what interval?
Annual?
Annual. Every 12 months. How far away should you be from a fire extinguisher? Approximately. So would it be 25 feet, 30 feet, 75 feet, or 100 feet?
What was the question? 25 feet.
How far away should you be from a fire extinguisher? Officially. "75 feet, I think. Where is the fire extinguisher here?
At the ends of the hallways.
At the end of, out the door, or the end of the hall, on both sides. What?
We don't have one in each room.
No, we don't, because we don't need them in each room. We should know where they are though, and how far away are they,
You said 75 feet.
approximately, yeah. Why should the fire doors be kept closed?
To contain the fire.
Okay,
Smoke maybe? Or no? Does it contain the fire?
and smoke. I'll give you the choices here. The door will keep patients and staff time to evacuate. The door will hold the fire at bay for a certain amount of time. The door will stop the smoke from passing into an occupied zone, or all of the above.
All of the above.
Yeah, okay. So where would you find an evacuation map?
Of the door.
Is it near the stairwell? Or near elevators?
Is it another all of the above maybe?
So the choice is here, close to a fire door, close to a fire extinguisher, close to a fire pool, or all of the of the above.
All of the above.
Where are they here?
Like the doors?
There'll be, no, the evacuation maps.
Oh.
They're outside, close to the fire. I think if you open that door, you'll see one.
I think so. I know I've seen one.
I never noticed.
Yeah. And where's the fire extinguisher and the fire pole? Yeah. So they're close to both of them.
You know, that's the only one in the hall.
There's another one just up at the other end.
No,
Yeah. And there's one on this side, exactly the same place. Okay, what is the code for a missing infant? Code pink, yeah. What's the code for a fire? Yeah.
What's the fire?
What?
What's the one for fire? Red?
Yeah.
Yeah, well, I wasn't sure. I wouldn't pick pink for a child.
When you give birth, they give you a pink bracelet.
Yeah. Code pink is actually for a missing infant or a missing child. Usually a missing infant, usually. What's the code for a bomb threat?
Black bar,
Yeah, because everything goes boom and it's all black.
because you're dead.
What's the code for a hazardous spill?
Orange?
Orange, yeah. What's the code for an active shooter? Anybody?
It's silver.
Code silver,
Yeah, well,
And there are other codes, but those are the basic ones. What's the code for cardiac arrest? What if it was a pediatric one? It was a child. Normally, no, it's always code blue. Normally, what they would do is we call code blue pediatric.
Wasn't there a brown for something?
There is a brown, yeah, but these,
Weather.
yeah, the code brown isn't nationally acceptable or nationally done, so they don't really include that. There are certain areas where you have certain codes. If you're in a tornado zone, they would probably have a code brown because you tend to get a lot of those in Tornado Alley. Any questions on those codes? Those are the basic codes. Those are the codes that are normally throughout the US. There are other ones, but those are normal. Any questions on either of the midterms?
So this one's shorter.
This one's got 35 questions. But don't get too stupefied because the finals are going to be long.
Oh, no.
Maybe.
Just make the finals a combination of all the tests.
Yes,
Wait, what?
That
yes.
we've already had. That we've already had.
Yeah.
So
The finals are everything you've had this semester.
Oh.
Plus some? Or
Dang.
shut up. Is there gonna be
No, this is only,
kind of stuff we learned from now?
the finals will be everything, the finals at the end of the semester will cover everything that we've done in this semester. So that's why it's gonna be long. So next week, we will do the, the 2 exams, and basically we'll do the same as we did today. We'll start at 9. I'll give you a certain amount of time. We'll have about half an hour break, just to clear your mind and go potty, or whatever you want to do. And then at the end, and the one thing, before we go, the one thing I'll make true is that you can, if you want to finish the test and go over it, but you don't want to sit here and wait for everybody to be done, you can quietly go out and hang around the hallway and don't make too much noise. Or if you want to finish the test and go, then you may do so. In other words, if you don't want to go over the test. However, with 2 in a row, you might want to hang around somewhere. But the second one, if you finish, you don't have to sit in your chairs. You can go outside, but please be quiet. Don't scrape your chairs or anything. And just hang around in the hallway.
So the second one, if you don't wanna hang around, you can just leave?
Yes? If
So,
you-
but we're gonna go over it
If
as a
you're
class.
confident in your,
Yeah, we're gonna go over both of them,
At the end.
one at the end of each of them,
oh, I see what you're saying.
Oh.
okay? But if you, well, I can put it the other way. If you don't want to go over, we can go over them the week later